Hi, this is Dr. Ryan Rehl. I'm here with Dr. Dan Hurley, and this is From the Top. We're up here on Camelback Mountain. It's June 13th, and we got after it early this morning. This is our inaugural video podcast to talk about different topics that interest us in healthcare, wellness, fitness, and today we wanted to talk about nasal congestion. We're both ear, nose, and throat doctors. We spend a lot of our time treating nasal obstruction, nasal congestion, improving people's lives, getting them breathing better, just helping in general with their wellness, sleep quality, and respiratory diseases. So we want to talk today about what is nasal congestion, why it's important, and I'll have Dr. Hurley go through some topics here.
So first couple of things are, one, with nasal congestion, why do we breathe through our nose in the first place? Why is it important and why does it matter to us? And so we'll briefly run through that, both with respect to a comfort, quality of life standpoint, as well as a few of the points that we may touch on in later episodes about why it matters from a medical standpoint. And then I'll briefly run through why your nose obstructs, so you can kind of put it in a picture or story mode. So Ryan, take it away.
So Dan, if I'm a patient coming into you and I can't breathe through my nose, tell me how you approach the patient and talk to them about what could be the cause. So what's your kind of diagnostic algorithm you go through?
So I split it up into a couple of different things, and briefly, inflammatory versus anatomic. So inflammatory could be something like allergies or an infection and that sort of thing, and that's not going to be the focus of today for the most part. And then anatomic. So your nose can obstruct in a few different places, and there's essentially three main places that'll obstruct, assuming you don't have something like a mass, which would be unusual, so we'll skip that for today. I tell them to visualize their nose like an A-frame house or an A-frame roof, because everybody's seen an A-frame roof. A-frame roof has a midline wall that supports the roof. That's your nasal septum. So if you heard of somebody who has a deviated septum, it's either to the right or the left, and it's a fixed obstruction. So if you have a septal deviation, you can't breathe through that side. And interesting, you usually sleep on the side that it's deviated to. So that's number one. Number two, if you can't breathe through your nose, you have these things in your nose called turbinates. Turbinates are erectile tissue. They get bigger and small with all kinds of weird stuff like temperature changes, moisture changes, allergies. Everyone knows what they are, because if you ever had a cold, if you lay on one side, clogs, go to the other side, it clogs again. If you use Sudafed or Afrin decongestant spray, which you shouldn't use on a regular basis, by the way, those just shrink your turbinates. That's what makes you breathe better. And then the final is your nasal valve, which is the outside of your nose. So if somebody breathes in, you watch it sink. And I compare that to the concept of sticking a vacuum cleaner in a tent, where you'll see the sidewalls collapse, and that's Bernoulli's or some physics law that I'm not real good at. But we can address any or all of those three, and I'll often tell patients, well, get yourself a bottle of decongestant, spray it in your nose. If you like that, that's your turbinates. The difference between the right and the left after you've done that is your nasal septum. And then finally, stick a breathe right strip on your nose, and that's your nasal valve, and then come and tell me what your problem is. So that's my brief summary.
And then throw the decongestant out after 3 days, right?
Correct. You can't keep using that.
Yeah. So, okay, great. Well, nasal obstruction really impacts patients profoundly. Patients come in, not only do they have congestion during the day, which bothers them from a general wellness standpoint, but these patients oftentimes have difficulty with sleep. They will get up multiple times throughout the night with congested nose. As you mentioned, the turbinates are spongy blood vessel tissue or erectile tissue. So the reason for that is that the turbinates are kind of like your HVAC system for your body. So as the air flows through the nose, and humans were meant to breathe through the nose primarily, the air gets processed. So there's some thermal exchange from the blood that's in the turbinates that temperature regulates and gets that air ready for your lungs. The turbinates also clean the air, so they have a mucus blanket over them. So they're oriented like radiators on the sidewall of your nose, these turbinates. and dust and particles, allergens, pollutants that you don't want getting into your lungs will stick to the mucus blanket on the turbinates. And then that mucus blanket also gives off water vapor. So, the turbinates are really important, but as it relates to that thermal regulation component, when patients lay down at night and their head is no longer above the level of their heart, those turbinates will engorge with blood. So that spongy blood vessel tissue swells. And so patients with nasal congestion during the day, you can bet that their nose is going to be blocked at night, and essentially make them a mouth breather at night, which can lead to snoring and awakening at night with a dry mouth, a clogged nose. And they'll have to just prop themselves up a little bit to clear the congestion, or sometimes resort to a decongestant or something. So these patients can be quite symptomatic, miserable in more ways than just the symptom of nasal blockage. So we see sleep disturbance. We'll also see problems with the throat, the teeth, and the lungs. So patients can get, from the mouth breathing, their throat will dry out, and that's bad because in our mouth and our throat, we have saliva, which is a protective mechanism. It's got antibodies and enzymes in it, and if you dry out your saliva, you lose that ability to fight off bacteria in the mouth. So we'll see patients who are chronic mouth breathers have a higher number of dental caries or cavities, and a higher incidence of gingivitis, and that can lead to things like halitosis. Also, the drying of the mucus in the throat can lead to halitosis and problems with the tonsils, repeat throat infections, and sore throats. And then there are some studies that support that asthmatics who mouth breathe, they have a higher incidence of exacerbated asthma. So getting a patient breathing through their nose can not only make them feel more comfortable during the day, but can improve their sleep, potentially improve any reactive airway disease or asthma, and help with the oral cavity issues too.
Yeah, so the bottom line is, when you think about your nose is like your filter. So it's your air filter and your humidifier. And that's fantastic. The only problem is, if you can't breathe through it, it ceases to function as either or both. And so the concept is, okay, at what point is that affecting someone's quality of life and or affecting medical issues that we need to intervene or help? And in future episodes, we could split those areas up and talk about specifically what people's options are, because there's multiple good options. Again, depending on whether or not it's inflammatory, infectious, or what we focused on today, anatomic. So I hope you enjoyed this little review, and we'll catch you soon from the top.
See you next time from the top.